Welcome to the deep dive. You're here because you want to really get a complex topic, understand it inside and out, but maybe without feeling like your brain's about to, short circuit from information overload.
Yeah, totally. We get that.
We totally get that. So today we're tackling something really significant. The connection between addiction and trauma, all based on a fascinating conversation with Dr. Gabor Maté that one of you actually shared with us.
Hmm.
Our mission here is really to cut through the noise and get to the heart of Dr. Maté's core arguments, moving beyond the usual kind of surface level understanding of addiction.
Exactly. And Dr. Maté offers this perspective shift that's, well, it's not just interesting, it's potentially transformative in how we see addiction.
Yeah.
The article you sent, it did a great job introducing his ideas,
Yeah.
and we're going to dive deeper into those key insights to help you grasp why his approach is so important.
Okay, so let's jump right into what I think is like the absolute cornerstone of Dr. Maté's thinking. He completely flips the way we typically look at addiction. Forget the usual questions about the substance or, the behavior itself.
Right.
His central point, the question he says we should be asking first, is this incredibly powerful one. The first question is not why the addiction, but why the pain. It really reframes everything, doesn't it?
It does. It really does. What's fascinating here is that immediate pivot.
Mhm.
Instead of focusing on, say, the gambling habit or the reliance on a substance, he directs our attention to the deeper, often hidden suffering that might be driving those behaviors.
Uh-huh.
Think of it like this. You see a plant wilting, you could just water the leaves. That's like the addiction. But Dr. Maté is saying we need to look at the roots, the pain, to truly understand what's going on.
And it's so much broader than just the stereotypical image of addiction, right? Dr. Maté has this really inclusive definition. He says addiction is basically any behavior that temporarily eases discomfort or brings pleasure that we crave that has negative consequences down the line and that we struggle to give up despite knowing those consequences.
That's right. And if we connect this to the bigger picture of human experience, you can see how this definition extends far beyond just drugs and alcohol. It includes things like compulsive internet use, excessive work, even overeating.
Right, all sorts of things.
Yeah.
Yeah.
It suddenly makes the whole idea of addiction feel much closer to home, suggesting that, many of us might have behaviors that fit this description to some degree, ways we cope with underlying discomfort. So the key takeaway here is that addiction isn't just about the what, it's about the why behind any behavior that becomes a crutch.
Exactly. You start to see these behaviors not as isolated failings, but as potential signals of deeper unmet emotional needs.
Okay, now, when we look at what's happening when someone engages in these addictive behaviors, the article touches on the brain's reward system, mentioning these things called dopaminergic systems. Now, that sounds a bit technical, but how does that fit into Dr. Maté's view?
Correct. Dopaminergic systems. They're essentially the brain's reward circuitry. When we do something pleasurable, these pathways get activated, releasing dopamine and making us want to repeat the behavior. Now, what's fascinating here and what Dr. Maté emphasizes is that for someone struggling with addiction, this activation isn't primarily about seeking pleasure in the traditional sense. Instead, they're looking for a temporary shift in their emotional state, a way to escape from feelings that are just too overwhelming to bear. So while the brain's reward system is definitely involved, the driving force is much more about avoiding pain than actively pursuing joy. Which brings us neatly to what Dr. Maté argues is often the fundamental source of this pain, experiences in childhood that we might call trauma. This seems to be a really central and a powerful part of his whole framework.
It is, yeah, and it's where his perspective takes on a really profound dimension. He suggests that childhood trauma, in its many forms, is kind of the bedrock upon which addictive behaviors often develop as coping mechanisms. Now, when he talks about childhood trauma, it's not just about the obvious things like abuse or neglect, what he calls the presence of harm.
Okay.
He also includes what he calls the absence of good. Think of a child whose parents are physically present but, emotionally distant, consistently unavailable to offer comfort or support. That lack of emotional nourishment, the absence of consistent nurturing, or a feeling of genuine security, that can also be deeply traumatic. Essentially, unmet needs in childhood create a kind of void that addiction then tries to fill later on.
And the examples he shares from his years working in Vancouver's downtown east side are just incredibly powerful and, frankly, heartbreaking. The article mentions that across 12 years of treating heavily addicted patients, every single one had a history of traumatic childhoods. It's just staggering.
It really hammers home the strength of that link. The fact that All the women he worked with had experienced sexual abuse, and all men had histories of significant neglect or emotional and physical abuse. It paints a very stark picture.
Yeah.
But what's also important is that Dr. Maté doesn't just focus on those extreme cases. He shares a more personal example, his own experience growing up in war-torn Hungary with a mother who was, understandably, deeply impacted by the trauma she had endured. He wasn't subjected to direct abuse himself, but the constant fear and his mother's emotional unavailability still constituted a form of trauma in his early environment.
That's such a crucial point. It really broadens our understanding of what trauma can actually be. It's not always the most overt, shocking events. It can be the more subtle but persistent impact of stress, fear, and emotional disconnection in a child's formative years.
Exactly.
And this early trauma, whether it's the presence of harm or the absence of good, leads to deep emotional pain, which then sets the stage for those compulsive coping behaviors we recognize as addictions.
Spot on. And this individual experience of trauma doesn't just exist in a vacuum. Dr. Maté also highlights the powerful impact of these patterns across generations, what we call multi-generational trauma.
Yes, this idea of unconscious behavioral patterns being passed down through families, it's so critical to understand. And I really appreciated how the article quoted him saying, blame implies fault, responsibility implies awareness. That shifts the focus away from judgment and towards really understanding these deeply ingrained patterns.
That quote is so insightful, isn't it? It emphasizes that recognizing multi-generational trauma isn't about pointing fingers or, assigning blame to previous generations. It's about developing an awareness of these cycles of behavior, understanding how past experiences can shape present realities so that we can potentially make different choices and, well, maybe break those patterns.
Right.
The article explains how children internalize their environment. So if parents are grappling with their own unresolved pain, which might manifest as depression, high levels of stress, or emotional unavailability, it's not necessarily a conscious choice or done out of malice, but their children can internalize that emotional landscape and develop vulnerabilities to addiction or other challenges later in life.
It really underscores how deeply interconnected we are, not just within our own lives, but across generations. Now, Dr. Maté also delves into the connection between the mind and body and how all of this relates to our physical health, which I found particularly thought-provoking.
Yes. This is where he really challenges that traditional Western medical separation of the mind and body. What's particularly compelling here is his argument that chronic, often unconscious emotional stress can have very tangible and significant effects on our physical well-being, especially our immune system.
Yeah, the article lists a number of conditions, things like autoimmune diseases, chronic fatigue, eczema, and even potentially cancer, and suggests that they can be influenced by this long-term emotional repression and the lingering effects of trauma. It's a perspective that really encourages us to think about our overall health in a much more holistic way.
It absolutely does.
Yeah.
And his book, When the Body Says No, which the article mentions, explores this connection in great detail, looking at the price our bodies pay for holding on to hidden stress and how our emotional patterns can manifest physically. The anecdote from the BBC documentary, you mentioned it earlier, where addressing family dynamics and emotional histories had a more significant positive impact on chronic illnesses than purely medical interventions in some cases. That really brought this idea to life. It makes you wonder how often we might be focusing solely on treating the physical symptoms without addressing the underlying emotional roots.
That was a really striking example. The idea that despite receiving conventional medical treatment, people continued to struggle until those deeper emotional issues were brought to light. It really highlights the interconnectedness that Dr. Maté talks about and makes you question how often we might be missing a crucial piece of the puzzle when we only look at the physical.
Right. This raises a really important question about our fundamental approach to health and healing. Dr. Maté's core philosophy, as the article summarizes it, is really about recognizing addiction not as a moral failing or a disease in isolation, but as a response to deep-seated pain, and seeing illness as potentially shaped by these ingrained emotional and relational patterns. Therefore, healing, both from addiction and physical ailments, often requires addressing those root causes, the early childhood trauma, the habitual emotional repression, the underlying feelings of disconnection.
So the fundamental takeaway really seems to be this call for a more compassionate and holistic understanding of ourselves and others. It's about shifting away from judgment and blame and moving towards recognizing the often invisible underlying pain that drives so many of these challenging behaviors and health issues.
Exactly. Awareness and compassion, as the article points out, become the essential starting points, not just for individual healing and taking responsibility for our own well-being, but also for fostering broader systemic change in how we understand and approach addiction, mental health, and even physical illness in our communities.
So it all comes back to that initial powerful question, why the pain? Understanding that, really digging into those roots, seems to be the key to truly understanding addiction and, well, a whole lot more, doesn't it?
It really does.
It completely changes how you look at the issue and the people who are struggling.
It fosters a level of empathy and understanding that is so often missing in our societal conversations around addiction and mental health.
Yeah. Okay, this has been a really eye-opening deep dive into Dr. Maté's perspective. It definitely
Nice.
gives you a lot to think about. So for you listening, I want you to consider this. How might this perspective understanding addiction not as a choice or a moral failing, but as a response to pain, often rooted in early experiences?
Yeah.
How might that shift your own understanding of addiction and perhaps even other challenging behaviors you see in the world or even maybe in yourself?
Yeah.
Yeah.
And to take that thought just a bit further, consider this. If we truly recognize this deep and powerful link between early experiences, trauma, and the coping mechanisms we develop, whether they become problematic or not,
Yeah.
how might that knowledge influence the way we approach our own personal challenges, the way we raise our children, and even the larger societal issues we grapple with? It's definitely a perspective with far-reaching implications, something really worth reflecting on.